If the examples of China and Italy had seemed far away these last few weeks, coronavirus came home on Wednesday night in the space of a single hour, with a solemn presidential address from the Oval Office, the breaking headline that the NBA had suspended its season, and news that the beloved Tom Hanks and his wife Rita Wilson had been diagnosed with the virus. Harry Smith has our Sunday closer on this moment in America.
Here's what's up. We don't know what we don't know. The person sitting next to you on a plane who just sneezed, probably allergies. Or maybe, just maybe, they have COVID-19 and don't even know it. The bus ride, the subway, the taxi, the person in the restaurant who just handed you a menu. Do they have it? It's hard not to think about this stuff. For a country of more than 330 million people, the numbers of confirmed cases is pretty small. Of course, we don't know the real number because the means of testing is not sufficient.
It is a failing. I mean, let's admit it.
Still, it's easy to say odds-wise, it can't get me. But today, that's a sucker's bet. In Italy, a country that is shut down by the virus, there were just 157 cases on February 23rd. 6 days later, there were more than 1,000. Today, it's more than 15,000. It's like in a movie. Sure, every country is its own petri dish: age, mobility, healthcare system, government response. And on that note, a thought. There will be plenty of time for credit or blame later. But until then, doctors, epidemiologists, researchers, science people, let the science people do the talking. Just them. This, dear friends, is a time for unity. But America is that proverbial house divided. People so at odds we cannot agree on what's true. But what is true is this: the virus will not discriminate when it decides to infect you. It doesn't care who you voted for. So let's listen to the scientists, keep our distance, wash our hands. Lots of stuff is being canceled, postponed. What sounds sometimes like an overabundance of caution will likely save lives. It will be and is inconvenient and costly too. But we'll find the dividend is fewer sick people, fewer deaths. And on that, we should all be able to agree. For Sunday Today, Harry Smith, New York.